going to say the whole darn thing in health and wellness. We've taken advantage of people, and it's time for them to ask and know the questions to ask. Certificate of analysis, if you're taking a supplement, ask about the quality, know about it, and then ask the questions do I really want to take a pharmaceutical for a symptom, or do I want to try to find the root of the cause of why I'm having this problem? And let me fix the problem and not take a pharmaceutical to mask a symptom. We've been told for a long time that really the body does the healing, and it's physicians just trying to kind of keep the brain active on the person who has the disease until they get better. All the other stuff we're doing is just to try to keep them thinking that we're trying to help. Now, that's not 100%, but there's a lot of truth in that. Yes. If your people that work with you trust you, and they know that you're not trying to sell them a bunch of stuff, and that you're not trying to write a script and say, go away, hope it gets better, only come back if it doesn't. And really the body just healed with or without that drug anyway. If they want to be able to know that they're heard, and back to my why, because as you can tell, I like to talk, I like to educate. And I do have a lot of knowledge in my head from a lot of different things, is that learning to listen is the cancer patients and the pain patients too. The patients have taught me to work with my challenge of not naturally being a great listener, but they've taught me that because, when they say they go to the oncologist and the oncologist has the hand on the door when they're saying hello, they don't know their name. They can't remember their name. And they just say, you have stage 4 terminal cancer. You work with the nurse after this, and we're going to start chemo, radiation, and surgery. And they walk out the door. That's not good. They weren't heard. They don't even understand their disease. It's a terrible way to be doing medicine. But in the defense of the doctors, Gary, they don't have time. They're worn out. They're in a broken system. They have to stick within that box. They can't step outside of it. It's terrible for everyone involved. The system is completely broken. That's why we are being proponents of there's a better way to do this and treat this. So, my challenge on the why of listening has been honed and taught to me when I'm in front of a patient. When I'm talking to everybody else, I'm talking, but when I'm in front of a patient, I'm listening. People say, Dr. Worden, you do so many things. What do you do for relaxation? I say, sit in front of a patient. That calms me down. I listen. I put the pieces together of the puzzle and come up with a plan. That is what I do to relax. Besides, do other things.
Well, for those of you listening, Dr. Donese's why, like we talked about, is to make sense of the complex and challenging. And you can see that coming through loud and clear, right? She can solve problems like nobody's business. How she does that is by constantly looking for better ways. She's always on the hunt for what is better, what's going to make this, what's innovative, what's truly going to work. But ultimately, what she brings are outside the box, non-traditional, non-typical solutions that are going to work for you because she's done the research, she's found something better, and now she's bringing you something that's going to work for you. Does that feel right to you?
It does feel right. There are traditional therapies that make sense as long as it makes sense. And I'll say, okay, this one sounds good. This chemo for you is not that toxic. I can help you with the side effects, and it's going to kill 90% of your cancer cells. Let's think about it. Even though there may leave some cancer stem cells, Gary,